Hello, hello. How are y'all today? Dolly here. Wanted to come on for a second because I want to talk to y'all about a few things, and I feel like I look kind of funky. I'm trying to do this video outside, but it's kind of bright, so I didn't want to go out in the bright sun. But I wanted to talk to y'all because I just came back from a trip to Las Vegas. It was for my job, and it was I work for a health insurance company for my nurse practitioner job, and I do preventative health screening. So it was highly focused on prevention, and they presented to us a lot of statistics on the healthcare industry now and where we kind of are at. And it was kind of mind-boggling how much what the statistics showed for healthcare and people. Hey, Maureen. People in the United States. So when y'all hop on, tell me hi so I know you're here, because sometimes it doesn't show me. But it was amazing. They showed us statistics of healthcare expenditures, like comparing nations. And the United States healthcare expenditures are in the trillions and are the highest of all countries. Now, the United States is also very highly focused on not highly focused on prevention, and we have a lot of processed foods at our fingertips, and we have a lot of false advertising that we have to deal with. So it is a very complex problem. Okay, I come out to my typical place to do videos and see if this helps. So as I was saying, let me change where I have this set up here. So as I was saying, the problem for the U.S. is very complex, and there's a lot of different things that you have to kind of navigate in order to be successful in your health journey. And the way that we are so focused on being a free country and being able to say and do what we want kind of does us wrong when it comes to knowing what to do as far as our health journey, because there's so much false advertising. I actually heard a guy talk that's really into, hi Kyle, that's really into marketing, and he said that he was actually approached by a junk food company that was wanting to advertise some form of highly processed junk food that didn't really have any nutrition, and they were wanting him to figure out how to advertise effectively to diabetics. So he said that was like his last straw with marketing and the way that he was doing it, because he said he could not sacrifice his integrity to advertise something that was not going to help diabetics, but they wanted it to be advertised to diabetics. So that's kind of what we have to deal with when it comes to our health journey, is you've got to figure out how to navigate it. So what I have done is really tried to research the things that I'm doing and really focus in on what can be effective in my life that also could be effective for my children. Like, I'm not going to go and get some product that I wouldn't feel is safe for my kids. I work on good nutrition, fitness programs that are effective, that are short, that work well in my busy life, and then just kind of putting it all together. So the tips that I wanted to tell y'all about as I was thinking about this, as I thought about my health journey, and one of the things that I used to do was try to grab things that were free all over the place, like the internet has so much information, and try to put it together to work well for myself. At the time, I could not stand that my rear was kind of bulging and was causing my clothes to not fit right, and so I looked for ab and butt exercises on the internet. I pulled some of those off from some websites that are more focused on exercise, and started doing those. And then I wanted to build my arms, and so I wanted to try to find some different exercises for that, and I tried to piece it all together, but it never worked. It wasn't a system. It was just things that I was trying to put together to save money and not have to spend money on myself, and that type stuff. So that didn't work. I didn't stick with it. So what I encourage you to do as far as the exercise piece is you need to follow a system. Find something that, hey Agnes, find a system that you can follow that includes workouts, includes exercises that are designed by a trainer that has education in this. I certainly have education. I've got a bee flying around me. I have education in healthcare, but I can write you prescriptions. I can tell you what medications interact with each other, what would be the best medication for different things. My specialty is not in what specific exercises to do, and probably most of us it isn't. And one example I want to reiterate with you on that is that, you know, when we are raising our children, when we had that first child, we followed a system. We were told by our pediatrician or by the nurses at the hospital, you need to feed your baby every this many hours, and they need to, when they're at this age, they start eating rice cereal, and they're at this age, you start giving them baby food. At this age, you start giving them solid food. We followed a system for that, and we didn't question it, and we didn't try to make it up ourselves, because it was so important for us, and we always put our children first and try to do the best for them. We follow systems for so many things, but when it comes to our health, we're like, nah, I can figure it out, because we're not used to spending money on ourselves and doing things for ourselves, and we always want to try to be superhuman when it comes to that type of stuff. So I encourage you to follow a system. Now, the second thing that I want to encourage is that you don't neglect the nutrition. I see this so often. People will tell me, well, I'm not going to focus on the food. I'm just going to do the exercises, which that's one way to start, and we all start somewhere. But at the same time, you're leaving results on the table. Now I've got two dogs trying to climb on the table. You're leaving results on the table. Even if you're following a system for exercise, if you are not giving your body the fuel that you need in order to utilize those workouts effectively, then you might as well just throw some of that workout out the window. And I did that for a long time because I couldn't comprehend it all at once. But you have to kind of push yourself to improve your nutrition, okay? So that's part of the system that you need to follow, not just workouts, but nutrition. And then the third thing that I wanted to emphasize is that you need to be accountable to somebody. That is why I run my accountability groups, because it's a power in numbers. This morning I didn't want to work out. I had plenty of other things I wanted to do. But I got on into our accountability group. We have like 72 people in there right now. And several people posted, one girl, Crystal, she posted that she is down 19 inches since she started in the middle of January in our group. Another Crystal, there's more than one Crystal in the group, she posted that she is fitting better into a pair of jeans, and she had a picture, and there's like a gap like this of space in those jeans, and she said she was busting out of those when she first started with the group. It was that accountability that made such a huge difference for me this morning. If I wouldn't have had that, I would probably still be sitting on the couch looking at Facebook. So it makes such a huge difference if you take those three components, following a workout program that gives you a guide and takes the guesswork out of it and doesn't make you have to try to piece things together from different places that you can't necessarily trust and that don't necessarily go together in a systematic way to get you the best results. And then the second thing is the nutrition and fueling your body properly. There's several different things that I use to help me with that, so I'm happy to share those things with you. And then the third thing is just being accountable to someone. So if your thing is not being in a private Facebook group like we have, I mean, it's a secret Facebook group, no one else can see what we're posting in there, so it gives you privacy, but you develop a little community that supports each other. If that's not your thing, if you don't want to follow a system like what I'm following, but you want to have accountability, find someone in your life that you can be accountable to, that will say, hey, get up and get moving, get off the couch, get off Facebook, get off Candy Crush, whatever. I'm talking about myself with a lot of those things. So if you can do those things, you'll save yourself time, because I wasted so much time, years of time, trying to figure this all out. And these are the three components that have made the most powerful difference in my life. And I will not continue doing them, and I will not stop doing them, and I will not stop sharing it because of the statistics that I heard over the week when I was in Las Vegas for my job, because the healthcare expenditures are through the roof in the US. We are not focused on prevention. We were focused on Band-Aids and writing prescriptions. And I've seen it in my own jobs before the one I have now, where I had an employer be like, so you saw 48 people in a day, what's the big deal? Why are you upset? Like, but it's because I can't see a person effectively in 2 minutes. I need to take more time in order to help them. So I saw a lot in that job that was just band-aids, and I didn't want to continue working like that. And that's why I feel so passionate about bringing what I know and the experience that I have to y'all, so that you don't have to do the stumbling blocks that I did, and I can help to get you to a prevention standpoint sooner. So I hope that helped y'all. I hope you're having a fabulous Saturday. I hope you have beautiful weather like we do here. I know a lot of you don't because you're further north than me, but I hope you get some sunshine and warmth soon. All right, so y'all have a great day. Comment below and let me know that you've watched this. Sorry for rambling on, but I do get in a rambly mode when I am passionate about something. So y'all have a great one, and if you would like to know more about the system I follow in the group that I have, please comment below or message me, and I can chat with you more about it and tell you more of what we do to see if it's something that you would like to do as well. All right, y'all have a great day. Bye.